So the surgery for that is basically it's a ream job. You go in with a camera through the prostate.
Wait, a rim job something.
Not a rim
No,
job.
I heard rim job.
Ream.
Sorry. I was like, what kind of clinic you got going, man? What's happening at the Cary Square that we don't know about? I know there's free parking. Rim jobs. So we've spoken about a bunch of things. One thing I really want to talk about, besides the alarm, is one thing I wanted to talk about. The older you get, the more you hear about this. Men who have prostate issues, right? I want to hear, first of all, what is the prostate, right? Because that's what we want to know. What is it? What's its purpose? And what are the symptoms that there's something wrong with it? And how do we correct it? And how do we maintain good levels or make sure that we maintain it properly?
Right.
I want to know that.
Right. What a great question. So this is one of the issues that all men face, that our prostate is continually growing, usually under the influence of testosterone our whole lives. And I'm sure one of the commonest things that Dr. Steinberg is seeing is benign prostatic hypertrophy.
Oh.
So the prostate is continually growing, and then it starts causing some urinary tract obstruction.
Wow.
So trouble peeing, hesitancy, maybe some dribbling, and that can lead to obstruction sometimes. Some men are having some trouble completely going to the bathroom. They end up in the emergency room.
Okay, so this is a normal thing. The prostate grows over time.
That's
Every
the
man.
thing.
Every man. At 20, it's bigger than it was when they're 18. At 40, it's bigger. So it's the growth for men is different.
So that's why you see it. It's good. Back in the day, you didn't live this long.
Yeah.
So now
We never saw
more
it,
and
yeah.
more you're starting to
Yes.
see
But just to back a little bit, the prostate is a fertility gland.
Right.
It produces with the seminal vesicles the semen, which carries the sperm. And just so happens that two things. One, the urine flows right in the middle of it.
Wow.
So that's why BPH or an enlarged prostate can block that canal and cause problems. And that's every man has BPH. Not all men has symptoms from it. And also the nerves for the erections really are stuck up against the prostate, so it can have some erectile dysfunction issue. But definitely, by far, the most common prostate problem that we see is enlarged prostate.
Okay. And now I have a question. How do we, is there a way to soften it, decrease it, or a way to slow down the growth of it
Right.
at a certain point?
Okay, let's start natural, and then we can go to medication.
Yeah.
So in Europe, the first line treatment, they use a herb called saw palmetto.
Yes.
Now, there were studies on saw palmetto which show it's not so great. We don't use it so often here, but in Europe, they tend to have it a bit more. It can't hurt, but probably doesn't have a big impact.
Yeah, there was a study in the New England Journal of Medicine, and this was a real scientific study showing that saw palmetto versus placebo is equal. It is not one of these herbs that hasn't been proven.
Yeah.
It's actually been proven not to work.
Wow.
But
so it's just a waste of money.
yeah, but
It's an
it's
actual
hard to
pill?
argue when a guy comes in and
It comes in a pill
Yeah.
form.
Okay.
Yeah.
Yeah. So this comes from the New England Journal of Medicine.
Right.
A real
Journal.
journal.
Right.
And
Not such a great impact.
yeah.
Yeah.
Wow.
It kind of maybe makes patients or maybe makes some doctors feel better that we're doing something, but not a major impact. And
So
once your BPH is a little bit more than mild, you certainly have.
So
And
saw
many-
palmetto out.
yeah.
And many patients come in saying, "Look, I started taking it and I'm feeling better, so go
see,
for it." You know,
That's
That's
all
the
up
thing.
here.
So that's exactly the point. And then you can get into the medication.
So what's the entry-level medication?
So the entry-level medication might be one of the ones that we talked about. For example, finasteride or Proscar. So Proscar has been around now almost 30 years. And that has an interesting story too. So it shrinks the prostate and that buys you some time. Maybe you were getting up 2, 3, 4 times at night, and now it reduces a little bit the number of times you're getting up at night. It increases the flow of urine.
Okay.
And the interesting part with that is maybe our audience would know what's the connection between that and Propecia. Well, it's exactly the same drug.
All right.
But the people who made Proscar 5 years later, they said, hey, how come all these people who are giving for the prostate, they have a bit more hair growth.
It was seen as a side effect, so they started to market it.
And they rebranded it,
Yeah.
which was brilliant. Propecia, boom, another $1 billion
So
drug.
wait a second. Is ProScar cheaper than Propecia?
Yes.
Yes.
So if we
But-
get ProScar,
Yeah, but
Then we're saving money.
But it's a different dose. Proscar is 5 milligrams. Propecia is 1. But most people, what they do is they take the Proscar and they cut it in 4,
yeah.
and it's a fraction of the price.
Wow. So that's what
What
we
a great question.
Should we
just
be saying
figured
this?
out. Look at
Yes, yes.
Look at this
We're in so much
Indiana.
trouble.
way
Yeah, you
of
found the
saving-
discount.
Yeah, we found the discount. So we could just get what we could just do ProScar,
Yeah.
go buy it from the pharmacy, cut it up, sell it as Propecia, and just start a side business, side hustle, man. Like this is
Add
what I
some
think.
Viagra in
And-
there,
and
and ready to go.
20% of
side
them will
hustle,
get
right?
erectile dysfunction, which will give us more business.
Oh, Jesus.
Guys, I think we just found our side hustle. You know what I mean? I could do the ads for it. Yeah, we could start paying too much for Propecia.
I have a question.
Yeah.
Just Viagra was discovered that way as well, no? Was Viagra a medication for the heart, and then they started getting hard-ons, like, let's take it and sell it?
Yeah, that's also another great point. That's why one of the side effects of Viagra or sildenafil is actually low blood pressure. So if it was connected to the heart in that way. So you could give it, it's a very safe drug, but if you have heart disease, you have to be careful, especially if you're on a nitrate, nitroglycerin, which opens up, some people have angina because of blockages. So then you might have a dangerous mix between the Viagra and your heart medications or your heart condition. And then, Sam, there's different levels. So we talked about Proscar and these other medications like Flomax. And then ultimately, they'll end up with Dr. Steinberg because they may need another intervention
Wow.
Yeah.
for BPH.
So Proscar, or actually there's another one in the category, Avodart, shrink the prostate. Then there's Flomax and Zatrol, Alfuzosin. I mean, there's a bunch of different competitors which relax the prostate.
Right.
And then ultimately, when men have enough symptoms, surgery.
Wow.
So the surgery for that is basically, it's a ream job. You go in with a camera through the prostate.
Wait, a rim job something.
Not a
else.
rim
no,
job.
I heard rim
Not a
job.
rim job. Ream.
Oh, sorry. I was like,
Yes.
Like, what
I was like, what kind of clinic you got going, man? What's happening at the Kerry Square that we don't know about? I know there's free parking. Rim jobs.
Go for the free parking and leave with a rim job. So,
I mean, I'm like, rim job.
so a ream job.
Yes.
I'm like, is that where it came from? The rim job? Like,
No. So we go in through the penis with a camera, and we scrape out the inside of the prostate.
Wow.
And that can be done with a little electrical loop. It can be done with steam. It can be done with laser. Any kind of energy has been tried. Freezing it, microwaving it, sticking a needle into it. Someone's put alcohol into the prostate. All of them worked with because they debulk the prostate. They just sort of kill the prostate cells and open up that hole which you pee through.
Oh wow.
So
you put alcohol. Who's put alcohol?
people have done studies on it.
Dr. Steinberg,
Poor bastard.
I think the whole male audience is squirming right now.
Yes.
Yeah.
Could you maybe elaborate on like how safe a procedure
Yeah.
it is and really like, you know,
But just to say, before these medications were, before 30 years ago or so, when these medications become popular, this was one of the most popular surgeries in North America. It works great. You can get a guy who's, barely able to dribble on his shoes to pee like an 18-year-old again.
Huh.
You open up that passageway, and because the bladder's always, your bladder's been working against that prostate, and all of a sudden you release the floodgates, and you can, I can pee on Ebby from all the way across the room,
oh my God.
Can we have a demonstration?
Oh, Jesus.
I have a question.
And who wants to pee like an 18-year-old? Remember 18, you'd miss the toilet all the time?
Oh, no.
Like, you didn't have any control whatsoever. Like now your aim gets better as you get older. So but ideally you want to pee like a 35.
Oh,
36.
Yeah, we can do that. We can
Wait.
make your prostate.
I have a question. How your pee comes out? Is there any,
Oh, yeah.
it comes out slow or dips or
Oh.
it goes
The intensity of it.
Like does it
Yes.
Yeah,
say your health
Well,
overall?
one of the it's just a sign of your prostate and the blockage. So actually, we have this machine in my office. When we work up patients who've got urinary symptoms, is we get them to pee, and it measures how strong they pee.
Oh, wow,
It
that's
measures
cool.
the flow.
Wow.
So that's a direct reflection of how large is the prostate getting and how much pressure is it putting on that flow of
Yeah.
urine and blockage
So
in
the
the
bigger
bladder.
your prostate,
the more the blockage.
Usually,
Yeah,
you can
so
have
the more it just dips
Yeah.
down.
you can have smaller prostates that block, and you can have huge prostates that don't block. But generally, that's the case.
Is the
And
sperm related to that?
yes, well, sperm. So what happens is the safety of the surgery. It works great. It's a very safe surgery. But what happens is when you ejaculate, you get what's called retrograde ejaculation. That doesn't mean ejaculating behind you. Instead of the sperm takes the path of least resistance, or the semen. So instead of coming out, you feel an orgasm, but nothing comes out because it's going up into the bladder.
Wow.
That happens.
Yeah, after the surgery and after some of the medications, Flomax, you can have these dry comes.
But wait, the sperm goes back in?
Yeah. So if you would look at these people's urine after they ejaculate, if they ejaculate and pee, and you look at it in the microscope, you'll see sperm.
Wow.
So it is safe and effective. Side effect is essentially retrograde ejaculation. There's a rare incidence of men becoming incontinent. That's extremely rare. Probably less than 1% of men, and erectile dysfunction also very, very rare. But it's a safe surgery and extremely effective.
I don't know what you found, but I find when I'm examining them, they're not low-level exercise. They're high-level exercise. And like, you've got the prostate of a 20-year-old. This is all just, I'm just
I
telling
can
you.
check all your prostates now, and we can correlate that with your level of exercise.
Wow.
How many guys do we have in this room? Get me a box of gloves.
Prostate check and correlate with the exercise.
I've never done it. I'm not doing
you
it.
need
now.
a rim job?
Yeah.
We're not doing that. This is not that kind of movie.
No, he's a trained expert.
It's after hours by now.